In fact, this talk is of my experience, and most of the information is not available in the books. So, many of you must be knowing, seniors will be knowing that we started the coblation in 2003, and my first 10 tonsil patient had a phenomenal pain, more than the diathermy tonsillectomy. And after doing for about 10 cases, I instructed my staff to throw this in the store. Literally we did that. Maybe after 2-3 months, I realized there is something wrong with me, not with the technology. So then I talked to the company, and at that time it is in Sweden, and Peter Lazar, he said, Dr. Timms is in UK, he is a good surgeon on tonsillectomy. The video what you have seen is done by Tim. In fact, I saw the video of the tonsillectomy. That time they gave us in a CD. I saw that, I thought I can do the surgery. I'm ignorant. And then I realized I don't know anything about the coblation. So then what to do? There is not enough literature about the coblation at that time. And whatever literature is against the coblation, in fact. So then we invited him to India, to Hyderabad, and we did a live surgical workshop. So my professor Y.N. Mehra, late Y.N. Mehra, used to say something. If you are weak in any subject, give a lecture on that. And obviously you have to learn, you will learn. So we did a workshop on the subject where I am very weak, and that's how we learned. Thanks to Mike Timms. Study on the tonsillectomy stating that coblations are no use. The reason is, the myth is that, in fact, whatever has been published is a myth. Tonsillectomy with coblation has a high risk of bleeding compared to the cold steel instruments. And pain is more in the coblation than with the cold steel instruments. In fact, this is true in my first 10 cases. And during my post-graduation, I did 1,000 tonsillectomy. There are days, in one day as a PG student, I did 15-20 tonsillectomies also. So, but that's a different scenario. So I consider myself as an expert in tonsillectomy. But when it comes to the coblation, I am zero, rather minus. So the myth is, because I use the coblation machine and I press the coblation yellow pedal, hence the machine does the coblation. This is a myth. It doesn't happen like that. Yes, like me, many surgeons do think that they have done thousands of diathermy tonsillectomies, and they have seen the video, now got the machine and the band, so they think they are fit to do the surgery as well as compare the techniques. The fact is, the surgeon is under the impression that he has done coblation tonsillectomy, but the fact is he used more coagulation or diathermy unknowingly, and the results are attributed to the coblation technique. But his technique is wrong. So why this is happening? The device has both ablation and coagulation. See, the surgeon has to use more ablation and less coagulation, not by just simply pressing the right pedal, but also he has to understand the principles of the electricity travel. Another important problem is unlearning the technique. What I observed is, after I learned the coblation technique, when we started the DNB program, all my DNB residents understood the coblation in 2-3 surgeries, and they were doing a very good job. Whereas for me to learn the coblation, I spent at least 40-50 surgeries, whereas they learn very fast. So then why how come I'm an idiot, or they are very intelligent, or they are smart, they learned in 3 surgeries? So then I realized I have to unlearn the conventional tonsillectomy. So in conventional tonsillectomy, we do the surgery by touching the tissue with our instrument, whereas in coblation you should not do that. So in my first 10 tonsillectomies with coblation, I was using the wand to touch the tissue, and that is the feel, that's how we do. And so we do either by contact or touching, cutting. And another mistake what we do is, if there is bleeding, we allow that to bleeding to complete, and we do control it at the end of the